So chances are if you're here, you're dealing with sciatica. You're in pain, and you're trying to figure out what to do next. Let's get you some real clarity. We're going to break down the two main types of epidural injections. That's the Transforaminal, or TFESI, and the Interlaminar, so you can walk into your next doctor's appointment feeling way more confident.
And this is the million-dollar question, right? Which one is actually better for my sciatica? You've probably typed this into a search bar 100 times. TFESI, Interlaminar. You just want to know which one works. And that's exactly what we're going to get into.
But here's the thing. And this quote on the screen really nails it. We're asking the wrong question. It's not about which injection is stronger. It's about which one is the right tool for the job. It's like you don't need the biggest hammer in the toolbox, you need the right screwdriver for your specific problem.
So before we even start comparing the injections, we have to do the most important thing first. We have to know exactly what we're aiming at. Because let's face it, a perfect shot at the wrong target is still a total miss.
Okay, first things first. We have to be sure we're dealing with true sciatica. See, these injections are designed for a very specific kind of pain, called radicular pain. All that means is pain that's coming from a nerve root in your spine that's getting pinched or irritated. Honestly, one of the biggest reasons people are disappointed with these injections is because the pain was actually coming from somewhere else entirely.
So let's do a quick check-in. Think about your pain right now. Does it travel down your leg almost like a stripe? Is the feeling sharp or electric or burning? Does sitting down or bending over make it way worse? And is it mostly just on one side of your body? If you're nodding your head yes, well that's the classic pattern we're talking about. All right, let's decode your MRI report a little bit. The first spot we're going to talk about is called the foramen. Just think of it as the little doorway that your nerve has to pass through to exit the spine. If your problem is right there, at that doorway, doctors often call it foraminal stenosis. And that usually means they'll start talking about a really targeted approach, like a TFSI, to get the medicine right to that exact spot.
Next up, Zone 2, the lateral recess. So if the foramen is the doorway, this is kind of like the hallway the nerve goes down right before it gets to the exit. Now, a pinch here can cause that same classic sciatica, but this is where the conversation gets a little more interesting. You have to start asking, do we need a super precise shot, or would a broader spread of medicine work better here?
And finally, we have the central canal. This is the main highway of your spine. If you've got narrowing here, the pain might feel a bit different, maybe like a heaviness or cramping in your legs, especially when you walk. This situation often calls for a totally different strategy, one that's less about a single nerve and more about providing broader coverage to help you walk further. And that brings us right to the main idea of this whole explainer. I want you to think of a TFSI injection as a laser pointer and an interlaminar injection as a floodlight. You wouldn't use a floodlight to point something out in a presentation, and you wouldn't use a laser pointer to light up a dark room. They're both useful, but they're different tools for different jobs. So let's lay it out side by side. With TFSI, the goal is all about precision. It's that laser pointer hitting one specific nerve root. With interlaminar, the goal is coverage. It's the floodlight, spreading the medicine over a bigger area. So the real question to ask your doctor isn't, which one's better? It's, for my specific problem, do I need the laser pointer or the floodlight? And here's a super practical way to look at it. If your pain is definitely on one side, and your MRI points to a clear problem right at one of those nerve exits, you're probably going to be talking about the TFSE. But if your symptoms are more spread out, or the MRI shows issues at a few different levels, then the conversation might start leaning more towards the interlaminar for that broader coverage. Okay, so what happens when scientists actually compare these two head-to-head? What does the research tell us? It's really important to go into this with your eyes open. The data gives us some helpful clues, for sure, but it rarely gives us one simple, guaranteed answer for everyone.
So when you look at the timeline, what you see is that some studies suggest the TFESI might give you a little bit more pain relief right at the beginning, like at the 2-week mark. But here's the crucial part. After about 6 weeks, those differences usually shrink or just disappear altogether. What really matters for your long-term success is getting the diagnosis right and having a great rehab plan.
And if you take away just one thing from all the research, let it be this: getting the diagnosis wrong in the first place, or having the procedure done with poor technique, will have a way bigger impact on your results than whether you chose a TFSI or an interlaminar. The accuracy of the target and the skill of the person doing the injection, that's what really counts. Okay, so you have all this information now. What do you do with it? How do you actually use it to take back some control? Well, this last part is all about action. It's about turning what you've learned into a real plan.
so you can have a much better, much more productive talk with your doctor.
Here it is, your 3-step plan. It's super simple. Number 1, confirm the target. Ask your doctor, where do my symptoms seem to be coming from? Number 2, match the tool to the target. Ask, so are we going for precision here, or do we need broader coverage? And number 3, define what a win looks like. Is success being able to sit through dinner? Is it walking to the end of the block? Get really specific.
You can literally think of this as your script for your appointment. Instead of just asking, which one's better, you can ask things like, looking at my MRI, which zone seems to be the main problem? And why is this specific route the best tool for that target? See how that changes the conversation? It makes it all about your specific case and ensures there's a clear, logical plan in place.
Let's completely reframe why you're even getting this procedure. An injection is not a passive fix. It's not a magic wand. In the absolute best-case scenario, what it does is open up a window of opportunity, a period of time with less pain that you can use to really dive into physical therapy, get stronger, and start getting your life back. The injection opens the door, but you're the one who has to walk through it.
So we'll end right back where we started. The most powerful question you can ask isn't TFESI or interlaminar. It's okay, this injection might create a window for me. How am I going to use that time? Because the real goal isn't just a few weeks of relief. It's using that relief to build a stronger, more resilient foundation for your future. And that's how you truly take back control.